This video is the sixth and final part of a series which explains the basic principles of root canal treatment of a single-rooted tooth with simple root morphology. In this video we will discuss the process of obturating the root canal system. You will need a master apical cone, sterile paper points, sealer, accessory gutta-percha cones, a finger spreader, a flat plastic, an endodontic plugger, cotton wool pledgets, resin modified glass ionomer, and an endodontic kit. Taking a master apical cone that corresponds to the size of the finishing file used, seat it into the wet canal following the removal of the intra-appointment medicament. A trial point fit radiograph should be taken to confirm that the master cone gutta-percha sits within 1 mm of the radiographic apex. If the cone is beyond the apex, this may indicate the need for a larger sized cone. If the master cone is coronal, it may indicate inadequate finishing, meaning the need for more instrumentation using rotary finishing files. Once the correct position of the master apical cone is confirmed, the gutta-percha cone should be removed and the canal dried with sterile paper points of the correct size. Pre-coat the accessory files in paste in preparation for cold lateral compaction. Measure the master apical cone to working length and lightly cover in sealer. Gently place into the canal to working length until a definitive stop is felt. Insert the finger spreader and hold while applying apical and lateral pressure for 10 seconds. Remove the finger spreader with a gentle rotation. Lightly coat an accessory cone in sealer and place into the canal. Repeat cold lateral compaction until no more cones fit into the canal, that is, when the finger spreader doesn't insert further beyond the pulp chamber. Given that the filling is satisfactory, remove the excess gutta-percha with a warm flat plastic or a spoon excavator. Compact the gutta-percha vertically using an endodontic plugger. An obturation verification radiograph should be taken at this point to confirm a void-free root filling to an adequate length of the root canal. The inside of the access cavity should then be cleaned with an alcohol-soaked piece of cotton wool or a microbrush up to the cemento enamel junction to avoid staining of the crown. A long-shanked rosehead burr in a slow-speed handpiece may be used to remove the excess gutta-percha from the crown over the cemento enamel junction. Finally, once the definitive restoration has been placed, remove the rubber dam and check that the restoration is not interfering with the occlusion. A final post-treatment radiograph should be taken and post-operative instructions should be given to the patient. This is the end of the 6-part series which discusses the basic principles of root canal treatment of a single rooted tooth with simple root morphology.